Good morning, Ms. Ryan. I'm your physiotherapist for today. My name's Laura Langford. How are you?
Look, not too bad, Laura. Look, but yeah, obviously I've come because I've got some pain.
Yes.
Yeah.
So where is this pain located?
I've got some pain in my shoulders and also up in my neck. Yeah,
now,
that's
has this been short-term or a recurring injury?
Look, it's been really a long term. It's over the last 12 months. About 10 months ago, I got assaulted at work, and that resulted in me getting a prolapse of my C5, C6 disc. And the end result was I needed to have a cervical disc replacement done in September last year.
And can you tell me a little bit more about the injury and the surgery that followed and how the recuperation was?
Well, it was a strangling episode. It was quite a violent assault that was done. Yes, it was very, it was really quite distressing for me. And so obviously I did return to work initially after that, but then I got some numbness in my right arm and a weakness. So that's why it was necessary for me to have surgery so that I could get back to full functioning as soon as possible. So that was under work cover that I had surgery for the disc that was a titanium disc that was put into my neck.
Right.
And look, my initial recuperation was pretty good. I think, I did, the surgeon thought as though I did really well. The first 6 weeks was, I couldn't lift more than 2 kilos, just some gentle exercises on my neck.
Right.
And no physio, and then for the next 6 weeks I then went on to physio twice a week with some exercises, and I started doing some swimming, also just to get a bit more neck movement. And following that, I'd actually already, prior to all this, had booked. So I went overseas, and I travelled overseas for about 6 weeks with my family at the end of the year and the beginning of this year. And during that time, I think I did aggravate it. But even though I wasn't carrying my bags, and my son was doing that, but I still was wearing a backpack, and we had a lot of long flights with my neck in funny position. So I felt as though after that trip, I've come back in February with a bit more pain in my neck.
So the pain fled when you were overseas. Has it been ongoing since you've been away?
Yes, well, I have had a few little sessions of physio since my return, and that's helped a little bit. They've done some electrolysis type things on the back of my neck. I'm not sure exactly what it's called.
Yes.
And then I had some massage therapy and some ice, and that seems to have helped a little bit.
The pain's still evident?
Yes, I've still got some pain. I do notice that. That's why I've returned to obviously here today, because I've got some ongoing pain that I'd just like to get rid of that last sort of pain.
Well, hopefully we can do something about that. But before we go any further, can you tell me a little bit more about your employment and the type of family who've helped you through the recuperation?
Sure. Look, my employment is I work as an after-hours nurse manager in a hospital. So that's like a supervisor of the hospital, and I go to any crises and so forth. So work is put into place for me, and I do a lot of computer work otherwise. They've put into place an electronic desk so I can move it to different levels, so it's at the right level for my neck for doing any computer work, or I stand up and do the work if I feel like.
Has that helped?
Look, I think that's quite good. Yes, it means I can get some really good eye contact, and I'm not putting strain on my neck.
That's good.
And then I've also, look, in the initial stage, I did have somebody to help with the cleaning and with the ironing, but I'm now back to doing all those activities myself.
Right. That's good.
That doesn't seem to be, and doing the vacuuming doesn't seem to be a problem, those type of activities.
Yes.
But I do find that after a day's work, because I've only been back at work now for about 7-8 weeks, I'm getting some increasing pain.
Increasing pain?
Yeah, just after a long day. I think because I don't know, maybe I'm just using muscles I haven't used before. I'm not really sure. I haven't used for a long time, I should say.
And do you use any pain relief strategies to reduce or to eliminate the pain?
Look, I do occasionally take some pain because I've been getting a few headaches.
Right.
But I mainly try and use non-treatments, non-tablets, medications. So I've been taking a bit of some ice packs. And I also use some heat packs too. Sometimes I find that helps.
And when you use one of those methods, is the pain just removed for a short period of time, or is it do you not recognise the pain for a little while after that?
Well, I think it just helps, and it either gets me moving and just gets rid of those aches in it. So I might use the heat just before I go to bed at night. That feels better, but I might use the ice at the beginning of the day.
So would you say your
I feel as though both of those methods help the pain.
Yeah. Would you say the pain disrupts your sleeping patterns?
No, not really. Not really. I don't usually wake with sleep disturbances.
No, that's good. And in addition to the pain you experience now, is there any other medical history that has affected your health at the moment?
Well, I've got a few little, not a lot, but I've just got asthma.
Asthma?
Yep, and
that's been going on for a while now?
Yeah, 20 years, yeah.
Yes, long time.
Yeah, and so I just take some Ventolin and and Pulmicort for that, just a preventative.
Mm-hmm.
And I've got gastric reflux.
Right, yes.
And I take some Pariet for that. And I have a little bit of high cholesterol levels. And originally I was just doing diet to try and reduce the cholesterol down.
Right.
And then I went on, the doctor wanted to go on some tablets. I went on them for a short while. But I really felt as though I wasn't really happy taking the pill. So I've gone back to doing some diet, and the doctor's monitoring that.
Right, so you're just managing with the diet now and not medication?
Yeah, so, and if it's not working well, I might just have to go back on. But I prefer not to.
And besides the Ventolin and the pulmonary medication, do you take any other medication?
No, just the Panadol.
No, just the Panadol. Perfect. Okay. And judging your pain at the moment, would you say that it extends all the way from the neck or down the shoulders as well?
It's sort of, I have it in the top of my shoulders here.
Yes.
And I do have it just rotating up my neck. And I think that might be what's causing the headaches. And just at the back here, because it does get sore at the back.
Down.
Yeah.
Right. And then to judge your pain on a scale of 1 to 10, 1 being easy, not too noticeable pain, and 10 being the most excruciating pain.
Yeah.
How would you judge it now at rest?
Look, not too bad at the moment when I'm sitting here with you. I'll probably give it a 2.
2.
But
and in contrast, when you have like an active shift work,
look, sometimes at the end of a really hard day, it gets to a 3 to a 4.
3 to a 4, yeah.
Yeah. I mean, I know it's not a lot, but I just feel as though I'd like to be pain-free.
Of course, yes. And would you say that any specific movements have agitated your neck when you're at work or anything, or at home?
I did notice that after I played tennis, that it was worse after playing a session, because I've only just recently returned to tennis, that seemed to aggravate it. Right. And I also even noticed that, like, to take the dog for a walk, so tugging, that seemed to cause, so I've sort of reduced down a little bit on that.
Right.
And the other thing is, if I over-exercise, sometimes I notice that it's a bit more pain. So if I did way too many laps at the pool, if I did 20 laps, it might be sore, but if I do 12 or 14, it's okay. So if I do too much, it causes some pain, so just a bit of,
So would you say the pain limits you from doing these exercises, or just reduces the amount of time?
It reduces the amount. I'd like to be able to do more, because I think I need it for health purposes, but
Yes. And then would you say that besides the neck pain that you're experiencing, would you have any other injuries anywhere else in the body, or any other pain you're experiencing?
At the moment, no, not really. No, I'm pretty good.
And you mentioned before that you had tingling in your arms. Is that still present?
Look, I've still occasionally get it, but it's nearly returned to normal. It's about 95% of what I was. Yeah, and the surgeon said I can expect to get a little bit there, so I still do have a little bit occasionally.
Yes. Yeah. And besides the pain, that is obviously a bit of a limiting factor at the moment in the neck. How would you say your general well-being is?
I think I'm pretty good. I think I'm pretty good for my age. I usually walk every day for an hour, do my swim 3 times a week. I've now returned to doing tennis once a week.
Right.
As I said, I haven't been able to get back to I haven't felt comfortable going to the gym just yet, but I'd like to do that in the future. But look, I think I'm getting there. I just feel like I've got a little bit further to go to get myself back to my 100% health.
Perfect. And obviously, the goals we want to address during these sessions are pain relief, and we want to return you to normal functioning. And the hobbies you want to return to is tennis and walking your dog. Is there anything else that I've missed?
That was the gym. I'd also like I'd like to get back to going to the gym as well, and starting to do a few classes and just getting my stamina going a bit better.
Yes. Yeah. And the next phase in this session, we also want to observe your range of motion. But before we do so, is there any queries, questions or concerns you have about the following treatment?
No, I think that'd be good. No, I think I've covered everything.
Perfect. Now we're just going to move on to the next room.
Thank you.